Hi, I'm Sarah Perry, and this is my assessment video. So the first thing I would do is I would check the patient's electronic health record to see if there's any new labs in, any new medications, any orders, any type of information that I might need. Then as I approach the patient's room, I'm going to take a look outside, noting any post-its or any notices that will regarding things such as additional PPE that I might need, or any precautions, or if the patient's NPO, and I notice none of that, and so now I'm going to knock, knock, knock.
Come in.
Hi, my name is Sarah, and I'm going to be your nurse today.
Sounds great.
Let me go over and perform hand hygiene, and I'm going to close the door or curtain in this case to provide patient privacy. And can you please tell me your name and your date of birth?
Yes, my name is Tony Pollock, and my date is 05.
Okay, I'm going to take a look at your wristband, and I noticed that is right, and that both of those match with the electronic health record. And I'm also noting if the patient has any allergy or fall wristbands. I see none. And what brings you in today?
Yeah, I just have a bit of a headache.
Okay, I'm sorry to hear that. Tell me, when did this headache start?
Well, I don't have one right now, but I've been having just like kind of headaches in my temples for, the last few months.
Okay, on a scale of 1 to 10, 10 being the worst pain ever, how would you rate this pain?
At worst, I'd say like a 4. It's not much more than an inconvenience.
Okay, and you said the temple area, and does it radiate at all? Does it spread?
No, it kind of just stays right there, but it kind of pulses.
Okay, and is there anything that makes it better?
Yeah, like ibuprofen or caffeine usually.
And anything that makes it worse?
No caffeine.
And how would you describe the pain?
Yeah, like I said, kind of just like pulsing,
Okay.
throbbing kind of.
Okay, and you said it started months ago, and so how long does it last usually?
Like I said, I think it's kind of dependent on if I like take anything for it. I guess without it though, it's usually just an hour or 2 at most.
Okay, let me just add that into your record and have the provider talk to you about that.
Sounds great.
Okay, so and as I am talking to him, I am noting his posture. It is relaxed. I'm also noting that he appears alert. His face is relaxed. I don't notice any face drooping. I don't notice any ptosis of the eyelids, so there's no drooping of the eyelids. I'm also going to note if he's able to swallow, so I might offer him a drink and absorb if he is able to swallow it. I'm also noting that his face is relaxed, and as I said, he is alert. In the event that he was not alert, if he was, let's say, lethargic, I would probably do the Glasgow Coma scale, and in which I would note his voluntary eye movement. I would also note any intended motor movement and any motor response and verbal response. And I'm also noting that he doesn't have any body odor, so he is taking good care of himself. And while he is alert, I'm also going to ask him some questions. Can you tell me again what your name is?
Oh yes, Tony Pollock.
Okay, and please close your eyes for a second. Roughly what time is it?
Say about 8 p.m.
Okay, and where are you?
UMary Nursing Building.
Okay, he was a little off with the time, but he had the general point, so he is oriented to person, place, and time. And I'm also noting that he is responding to me verbally, and all of his responses are coherent. They are clear, they make sense, so he is able to understand, he's able to hear me at least at this current distance. And so also noting that he is upright. And so Now I'm going to continue on with the exam. So I'm going to get your vitals, okay?
Sounds good to me.
So I'm going to start with the pulse oximeter, so which is going to get the percentage of oxygen. So I'm also going to be noting if he has if he's receiving any oxygen, and if he is, I'm going to be seeing the fit of the mask, the position of the tongs, if he's getting a nasal cannula. I'm also going to be noting the flow rate, and right now he's at 95% oxygen, which is within normal limits. If it was below that, and it was not supposed to be below that, as nothing in his records says any conditions such as COPD, then I might look at the orders to see if I can raise the oxygen. If not, I would talk to the provider about getting a higher order for oxygen, or as he's already sitting upright. So I would be noting that in his chart. So and before I forget, I'm going to check his his pupils. So can you please look straight ahead? Okay. So his pupil is 5 milliliters in diameter on both sides, but it is also slightly dark here. So I'm now going to check the light reflex in both pupils. And the light reflex is present in both pupils, and furthermore, the reaction matches in both eyes, which is what we expect and hope to see. So now I'm going to get your blood pressure. So can you face this way, please? Okay, and is there a particular side that you prefer?
No, whichever's easiest for you.
Okay, so I'm going to measure the cuff size to make sure that I have the proper size, as a cuff that is too small could give us a reading too high, and a cuff too large could not read it at all. So it is the right size. And I'm also going to be making sure that his legs are not crossed. So I am making sure that his arm is as close to the same level as his heart as possible. This is as high as the table goes. I'm going to make sure that it is firm without hurting him. Is that too tight for you?
No. Perfect.
Okay.
I can hold that for you if you want.
Okay. One sec, your thing is a little hard to find. I want to readjust this. Got it. Okay, and his pulse disappeared at about 120. So I'm going to release it and I'm going to reinflate it at 140. And his pulse is 120/72, which I'll be documenting in his record, and it is what we would expect. And now I'm going to take his temperature. I'm using the temporal artery digital thermometer. Wait a sec. Okay, I got 99.2%. Little high, but it's also quite warm in this room, so not completely unexpected. And so would be documenting that unless he reports that he's feeling a slight fever coming on.
I am not.
Okay. Good, good. And so now I'm going to go on to the cardiac about the exam. So there are 5 locations: the aortic, so the aortic, pulmonic, Arab's point, tricep, and the apical/mitral. So these 2 locations is where S2 should be the loudest, and here is where S1 should be the loudest. I'm going to be listening using both sides of my stethoscope, and starting off with the diaphragm and then moving to the bell to listen for any advertitious sounds such as murmurs, and listening for when those murmurs take place, which could indicate S3 or S4. Okay, and at the apical point, I was listening for 1 minute, and I got 90 beats per minute, which is within the normal limits and what we expect. Now I'm going to be listening again using the bell for any advantageous sounds at those 5 points. And I heard no advantageous sounds, there was no murmurs, there was no whooshing, so which is what we would expect. And I'm going to place this back on him, make him more comfortable. And can you please cross your arms for me, please? Okay, and I counted 6 beats over the course of 30 seconds, which would be 12 beats per minute, which is within normal limits. Okay, and this whole time I'm also observing his skin, looking for any lesions, and noting the hydration of his skin, looking for any dry skin. I'm noting that his skin is pale with hints of pinkness. I'm noting the slight acne on his face, the freckles along his face, the mole right here near his right eye, and there are slight freckles on his back, particularly on the upper left shoulder blade, some slight back acne. There is a mole in the middle of the left of his back, and a mole right at the sacrum. I'm also looking for any lacerations or any impact to his skin integrity. Also feeling that it is warm. And now I'm moving on to the respiratory part of the exam. If you could scooch so your back is to me. So this is the posterior of the respiratory exam. So I'm going to be using the diaphragm. I'm doing 8 locations, noting any advantageous sounds, and also noting if he's using any accessory muscles. And I'm going to keep my stethoscope in the same place for 1 respiratory cycle at a time. Okay, posterior side, his lungs are clear. I'm noting right now no use of accessory muscles. There is no advertitious sounds such as wheezing or crackling. And now I'm going to the front. Same thing. Okay, once again, no advertitious sounds, and again, I'm still not noticing any use of accessory muscles. I will, however, note that there is another mole on his right shoulder, so as with moles, we're going to just keep an eye on them in case they are unexpected, if they change color, size, if they become asymmetrical. I'm going to return this, make it more comfortable. Okay, can you press against my hands, please? Perfect. Now pull against. Perfect. Now squeeze my hands, please. Perfect. So I'm noting the strength of his muscles in his hands and his wrists. And can I see your hands for a second, please? Flip them over. Okay, and I'm noting the capillary refill under 3 seconds. I'm also noting his skin on his hands and arms. I'm looking, skin is warm on both arms and hands. Slightly on the pale side, though his forearms do have some tanning. They also have a pinkish color to them. I would also note any IVs he has, as they would increase the risk to his skin integrity. And I would also want to check the flow for them and check the medication of the IVs. So, and next I'm doing skin turgor. So I'm going to take the forearm, pinch the skin. There is no tenting noted, indicating good hydration as well as good collagen of his skin. In the event that he was elderly, I would be using the skin just under the clavicle. And can you wiggle your fingers for me, please? Okay. Is there any numbness or tingling?
No.
Okay. That is what we expect. And
I can turn this
yep.
way if you need.
Perfect. And using your feet, can you press against my hands, please? Perfect. And now resist them. Perfect. Checking the capillary refill under 3 seconds for both toes. Perfect. That is what we expect. Please wiggle your toes, please. Any numbness or tingling? Okay, perfect. Oh, before I forget, going back to your arms, have them over, please. And I'm checking the radial pulse. And +2 for both sides, bilateral, which is within normal limits of what we expect. It means that it is neither thready nor bounding. And so now the lateral tibulus pulses, both sides. Okay, +2 on both sides, and I'm also noting that there is scarring right here on his right knee. There is hair well distributed on both legs. Now I'm doing the pedal pulse for both feet. And it's +2 on both sides. I'm also going to be noting any edema post-tibial. And there is no edema. And now I'm checking the ankles. No edema on the left. No edema on the right. Now the feet, no edema on the right, no edema on the left. I do notice that there is a large freckle on the left foot. Though it's symmetrical brown, we'll just keep an eye on that along the moles, making sure there's no changes. His feet are a little warm. There's slight tanning on both legs, though notice there is both feet are pale, though there is slight pinkness. And can you please lift both legs off the table, please? Perfect. And now the other one. Perfect. And so there is the muscle that we would expect for both the feet and the legs. And if he had been prescribed bed rest, then we would also take into account any changing of position. We'll also take a look at the head position, if he's supposed to be Fowler's, if he's supposed to be high Fowler's, low Fowler's, and per instructions, change his position as needed every 2 hours. If he was on bed rest, and using the Brandon scale, there is right now. Tell me, are you mobile?
I am. Yes.
Okay. And are there any medications that you're taking right now?
No, there are not.
And we've already established that he has feeling. And one second, I'm going to check something. Just close your eyes for a second.
Right.
Okay. And what side am I doing right now?
Left.
Okay. What side am I doing right now?
Left.
What side am I doing right now?
Right.
Okay. He has feeling in both hands and both feet. So he has no sensory deficiencies. So the risk of him the risk to his skin integrity is quite low. In the event that there was any concerns, there would be precautions that we would have, such as an air mattress in addition to the changing of position, and as well as his head position. And can you lie down? I would like to do a abdominal exam. So I'm just going to lower this. Okay. So I'm going to start off with inspection. So I'm going to be looking for any incisions, any drainage, any tubes, any ostomy bag, if he has an ostomy bag or anything of that nature. He does not. I'm also looking for any pulsations. There are none. I'm checking his stomach, and it appears flat, which is healthy, which is what we expect. And now I'm going to start with auscultation on the right lower quadrant. And tell me, How's your diet?
Good, well-rounded.
Okay. What do you typically have for dinner?
Usually some type of protein, some type of carb, and vegetables and fruit.
Okay.
Usually with some milk and water.
And how are you tolerating that?
Very well.
Okay. When was your last bowel movement?
Earlier today.
Okay. What did it look like?
Solid brownish color.
Okay. How many bowel movements do you typically have a week?
Probably say about one a day.
Okay. And I'm going to lightly palpate your abdomen. Please let me know if there's any tenderness or if you feel any discomfort at all.
Sounds great.
So I'm going to be feeling for any masses, any guarding, I should not feel any organs with light palpation, but if I do, that would indicate that they are larger than they should be, and I do not feel any masses or any guarding. Okay, you're good. And tell me, when was the last time you urinated?
I don't know, probably like 3 hours ago.
Okay, can you please tell me how much there was?
Yeah, I'd say like 2 cups.
Okay, what color was it?
Like light yellow to clear.
Okay, and how often do you urinate?
Probably 4 to 5 times a day.
Okay. So, and was there anything else you know about the urine? Was it cloudy? Did it have a smell?
No, ma'am.
Okay. And if he had a Foley catheter, then what we would be doing is checking the placement, making sure that it hadn't come loose, that it's not causing him any pain. We would also be checking how much he had voided, checking the color, the clarity, the amount, noting if there's any signs of a UTI. So, and you've already told me that you are mobile and don't need any assistance. So tell me, and have you ever fallen in the past?
No, I've not.
Okay, and you mentioned that you have no medications that have put you at risk of falling.
Correct.
Okay, so this is the standardized scale to determine the risk of a fall. He does not have a fall ban, but we would, as I stated earlier, but we would double check that if we thought it was a risk. And tell me, has your provider ordered any compression socks or TED hose for you, or anything to prevent a DVT?
No, they have not.
Or any what they would say would be clots in your legs?
Yeah, I'm not at risk for that.
Okay. And is there anything else you would like to discuss with me?
I don't believe so.
Okay. So I would then lower the bed down to the lowest level. I would make sure the wheels are locked in place. I would have 2 rails up, one on either side for patient safety, but not 4, as that would be a restraint. I would have the patient call light within his reach. So just hold this for me. Perfect. And just call me if you need anything.
Sounds great. Will do.
And now I am going to perform hand hygiene. I'm going to update his electronic health record. And that is it.